Good morning. Welcome to Leadership Insights video. I am very pleased to welcome Mandy Murdoch to our Insights video. My name is Vanessa Muirhead. I'm the Programme Director for the MSc in Dental Public Health Policy and Leadership at Queen Mary University of London. It's my pleasure to introduce Mandy Murdoch. I first met Mandy Murdoch about in 2013 when we were both working on a policy document working with Public Health England. Our paths crossed again several years later when again we were working together on NHS England on a procurement again, and Mandy there was an independent contractor, and our paths crossed again now, and I'm pleased to announce Mandy Murdoch is an executive coach. She's an accredited coach, and she works with senior leaders, and her role is to instill resilience and really foster a mindset of potential. So welcome, Mandy, to our Insight video. So I'm fascinated to hear about your journey. So tell us about your journey, Mandy.
Well, thank you so much, Vanessa, for giving me this opportunity. So if I had to describe my leadership journey, what I describe it as is really following more of a non-linear career trajectory. So what I mean by this is that I haven't necessarily stayed on a defined career path, but I've really pivoted between different careers when I've had an urge to do things differently. So to give a bit of background, I entered higher education as a mature student, and I've juggled work and study over many years. I love learning, and it's really important to me to be on a continual learning journey. And now I have what I would describe as a portfolio career, where I run my own business and I get to work on a variety of projects in the health sector in my consulting work. And then as a coaching psychologist, I also offer executive coaching services. And I believe that all the different experiences I've had over the years have informed and they've built on one another and created opportunities for me to grow both personally and professionally. And if I had to think about when my leadership journey as such first started, I would say it was in an inner city public health department where I landed my first strategic role after completing my master's in health psychology. And in this role, I worked with the consultant in dental public health and a wide range of stakeholders, including health service providers, clinicians, and academics, to develop and implement an oral health promotion strategy for the borough. Now, over time, as I gained more skills and knowledge and experience, and as my confidence grew, I was given the opportunity to lead on the oral health promotion programme across 2 London boroughs. And the programme's objective was to contribute to improved oral health and access to NHS dentistry through effective partnership working, strategy development, commissioning, monitoring, and evaluation of programmes. And I was also contributing to other areas of public health, including those related to children and young people's health, things such as childhood obesity and immunisations. Then over time, I worked my way up to a senior strategist role within the department. And at this point, I was managing a team of strategists and a portfolio of programs across the 2 boroughs. And then while working in public health, I was also given the opportunity to work with the National Institute for Health and Care Excellence, or NICE, and Public Health England, which is, Vanessa, where you mentioned we met at one point. And in those experiences, what I was able to do was to use my commissioning experience to contribute to the development of guidance for commissioners of oral health promotion services. So then, never wanting to stand still, in 2014, I was looking for a new challenge, and I decided to take the leap into consultancy. And since then, I've been supporting organisations to deliver a range of projects, mostly aimed at improving population health and the quality and efficiency of health services. Now, this has included projects with NHS hospital trusts, health service providers, local authorities, and other commissioning organisations such as NHS England. And the projects have ranged from finding efficiency and productivity savings and managing service transition programs to things like developing service specifications for health promotion services and conducting options appraisals, evaluating services, and then also managing service transformation and strategy programs. And over the last few years, a lot of that has been around dental and community pharmacy services in London. Always wanting to learn and develop new skills, a few years ago, I started looking into ways for me to be able to better utilize the knowledge and the skills and experience that I gained over the years. And I wanted to combine that with my interests in psychology and behavior change and health and well-being and management and consulting. And my research led me to my next career pivot, which is coaching psychology. And this really appealed to me because it manages to combine these different interests. So now, as well as working on consulting projects in the health sector, I also offer executive coaching to senior health sector leaders to help them to develop their resilience and the mindset that they need to reach their potential, and also to inspire their team and to enjoy their work more. So that's where I am at the moment.
Wow. I think there's so much that I just picked up. I was writing notes. You probably saw me down there. Some of the key words that you were talking about. And I think one of the things I heard you talking about is the whole idea of being a portfolio leader, which is a fantastic sort of concept. And the other bit that you mentioned was about having a strategic role. Mm-hmm. So my follow-up question would be, how important, because you've worked on so many different fields and you're not a dentist, how important do you think having that strategic approach to leadership has helped you across your career and managed across those different portfolios as a portfolio leader?
So I think with the strategic side of things, there's something about, being able to see the bigger picture. For me, what I find, and I'll probably come on to this a bit later, is, some of my strengths are around being very methodical and meticulous. So I like to delve into the detail. But then there's also something about teaching yourself to step back, understand all the different. So when I mentioned stakeholders earlier, and I mentioned about all the different stakeholders. So, for example, when we were working on the oral health promotion program, we were liaising with people who were in academia and research, also the clinicians on the ground. We were liaising with patients, with other people who were commissioning similar services, and also looking at the overlaps, for example, in public health. So we're also working really closely with colleagues in smoking cessation and healthy eating and all those kind of things. So just trying to think more about a long-term picture, thinking about the objectives of the organisation and how smaller projects can fit into that. Mm-hmm. And, at the time you might feel like you're just working on a small aspect of something, but actually all of that, if you're working towards a common purpose and a common goal, is hopefully going to make a bigger difference in the longer run.
And I guess it's, again, you're talking about having a bigger picture, understanding the operational aspects, but having, when you looked at some of the health priorities, child obesity, pharmacy, that's a topical issue. So having a real understanding of what's current and what's really important now. And the other bit that you mentioned about not being afraid to change and moving on, because every time I've seen you, you're in another role. And I remember when you were going into coaching, I thought, that's so brave. If I would have the courage to do that. But yeah, I think that's another important point of not being afraid to transition.
Yes. And again, something I'll come on to a bit later, but what I think is really important is, it can be, and I'm not saying that I'm not scared at all when I'm confronted with these challenges. But also, I think if you're really clear on your purpose and your goal, actually working towards that then becomes a lot easier, because you know that you are heading in a particular direction, and it means that you're willing to put yourself in positions where maybe, it might be perceived as a bit of a risk, but you know that you need to do that to get to where you ultimately want to be.
And maybe when we come on to the second question, when we talk about, what do you think are the qualities of a good leader? I think because you work with so many different stakeholders, I think that interaction, that maybe it's because you're a psychologist, that level of interaction, engagement, and able to work in different systems, again, would probably be helpful.